Are there any risks from mewing? Well, there can be, particularly if you're going to try this hard mewing. If you set off on a gargantuan chewing marathon because you've picked up some of the basics of mewing and you have any level of subacute jaw joint problems, you could really get into problems. And I want to stress this greatly because it can be very, very difficult to get out of them. It's a real hole you can get into, and really be careful. And there's three things to look out for with jaw joint problems. One is the maximum opening. See how many fingers you can put in. You should be able to get 3 fingers in. If you can't get 3 fingers in, be careful, but also monitor it. Take a measurement of your maximum opening. The other one, too, is looking at scalloping or marks on the sides of your tongue. If you have scalloping on the sides of your tongue, it is highly likely that you rest with your teeth slightly apart and your tongue wedged slightly between your teeth. Now, there's a high risk factor for jaw joint problems if you do this. It can be very difficult to spot if there's some scalloping on the sides of your tongue. The problem is, as soon as you use the tongue, as soon as the intrinsic muscles in the tongue activate, the tongue fills out and removes any scalloping on the sides of the tongue. A top tip is rest for a bit. Get a reasonable suction hold, and then use the light of your telephone, a nice bright light, stand in front of a mirror and then just ease back your lips, gently open your mouth. Don't activate your tongue at all, and see if you can look inside. And that will give you a reasonable, I hope, example of whether you've got any scalloping on the sides of your tongue. And remember, sometimes in some people, the scalloping can be really quite high up on what we call the dorsal surface of the tongue, the top surface. And the third one is doing the pinky test. The pinky test is where you take your 2 little fingers, you put them in your ears facing forwards so the balls of the little fingers can feel your jaw joints, and then you open and close and see what you can feel and hear. If you can feel any crepitation, as we call it, knocking, banging, creaking noises, clearly you've got subacute jaw joint problems. If you feel the jaw joint coming back significantly, you should just feel it when it comes back. If you feel any more, then you've got subacute jaw joint problems. Any pathology, any strangeness when you do the pinky test, don't go on a chewing marathon. You're going to cause problems. Maybe do tongue chewing, but I would limit it to tongue chewing.